want to talk about trends and requirements in regards to CDMO projects. To my left, we have Dr. Volker Sandig. He is our Chief Scientific Officer here at ProBioGen and a real crack in cell line development. To the right, we have Dr. David Probent, representing our Project Management Office, and with that, the right person to talk about customer needs, but also ProBioGen's GMP manufacturing capabilities. But let's start with a broader perspective. So, what is it that customers currently request the most in CDMO projects for biopharmaceuticals? Starting with you, Volker, what are you observing from the cell line development experience you're having?
Historically, clients approached us to make cell lines for simple antibodies, cytokines, enzymes. Now, complex molecule formats dominate. This means there's heterodimers to be dealt with, there's specific modifications to the product. There's a second aspect. Clients come earlier. When the final decision on a product has not yet been taken and there is multiple candidates. So those have to be processed in parallel. And the more, the better.
Okay. Anything to add from the GMP manufacturing perspective, David?
Well, of course, in the end, it's a product that our clients need. So the tox material or the material for toxicology studies, also the GMP material. And this needs to have a certain quality. So, of course, high product quality is a large requirement. And lastly, with overall cut development times, so drug development times, a CDMO must also be able to shorten its development timeline. And lastly, the client must be able to rely on the CDMO to deliver on time.
Is there something that may not be obvious as a, let's say, criteria before a project starts, but then occurs to be highly relevant within or during the project?
As requests become more and more product specific, a standard timeline and a standard project outline may not fit anymore. The CDMO needs to react to unforeseen challenges. There's always a challenge in a project. A cell may react differently or unexpectedly to a certain product. A novel peak may appear in a chromatogram. These issues need to be tackled, and still the timeline needs to be kept.
Easy game. So what I'm taking is, on the one hand, the projects are getting more complex, more individual, so the molecules are more complex, and at the same time it's key for the customers to get their manufacturing material in time, but also in the quality as needed. I think this is kind of the key requirement that a CDMO needs to be able to tackle and to deal with. Okay, let's move on. How can a CDMO partner make sure he's able to actually fulfill all those requirements? Volker, do you want to start again?
I guess understanding the product is key for the CMO. What product forms, what variants could occur? How can we detect them? How can we remove them when they are not desired? How to deal with those challenges is critical, and it requires scientific expertise, and that may not be visible from the start. What I mean here is a science-driven project leadership, project management, and this extends way beyond the molecular biology and cell biology you would expect from a cell line developer. The focus is on the product, and it's a protein, and its features are in the center.
Okay, so much about how to tackle diversification and complexity. So David, how can a CDMO actually make sure that he's able to deliver in time, but also, keep track to the promised schedule and timelines?
Well, there are two requirements, I would say. One, of course, is the actual project timeline at the CDMO, and here a CDMO needs to work with overlapping work packages with an integrated approach, because that is the only way how to shorten overall timelines. And then secondly, a CDMO must know what deliverables the the client requires and at what time. And the client must rely on such timely delivery in order to meet CDMO dependent but external timelines.
Volker, what is relevant here for a CDMO partner to make sure that he's able to deliver also perfect, accurate quality?
This expertise I mentioned extends to teams. Analytics need to be built in the cell line development program and in the team. A strong assay, biologic assay team is helpful. It is great if the CDMO has own technologies in the field, because this allows them to adjust more easily to the individual product needs. For instance, knowing how to integrate genes best, knowing about glycans and how to modify them, having a media platform. This is all very beneficial because he's more easily adjusting to the individual needs. And when the focus is no longer on titer, because titer comes with each clone, then you can concentrate on post-translational modifications and assure the quality.
Let's sum it up. Customers' key requirements are on the one hand getting more and more complex and specific, and it's key for them to get to the manufacturing material in time as agreed and in quality as needed. And with that, the respective CDMO partner should have the following capabilities and characteristics. He should have an integrated end-to-end process ranging from cell line development to manufacturing, including in-house analytics and bioassay development. Further, that's also what we said, it needs scientific excellence and also experience in various projects with at least similar molecules and requirements. And a very relevant aspect, especially thinking of the flexibility which is required. It's really key to be close to the client, and it's also really helpful if you're willing to go the extra mile and having the flexibility to react on unforeseen challenges which typically occur, especially in complex projects.